Good morning. Thank you for joining us today for a webinar. We're going to take the opportunity today to talk with you about an important community initiative that was held in September of 2018 during National Suicide Prevention Week with the goal of reaching a world record in instructing members of the community in the suicide prevention technique of question, persuade, refer. We'll have 4 speakers today, myself and 3 other speakers, and we'll be talking about components of the work that was done. And then we'll leave an opportunity at the tail end of the webinar to take questions from the audience. So we are here today to describe an effort that took place in the greater Louisville area during National Suicide Prevention Week of 2018. There's been a collaborative working in Louisville for the last 4.5 years to address significant health issues within the community. As part of that group, a number of committees have been working under the Louisville Health Advisory Board, and the Behavioral Health Committee had identified a goal of zero suicide as its community-based initiative. So this QPR community teaching initiative was really designed to allow us to further our goal of implementing a community-wide, evidence-based, and data-driven program to eliminate suicides in Louisville. We elected to utilize the timing in conjunction with National Suicide Prevention Week because of our recognition that there would be a lot of other press attention and public discussion regarding suicide prevention. And we elected to utilize the technique of question, persuade, refer as a validated technique that would be able to develop skills to the general community without the requirement of any prior clinical training. QPR is similar in concept to CPR. It is designed to really allow specific interventions to help stabilize a situation where someone may be contemplating suicide, and then allow communication or transfer of care to a clinical individual. In September of 2018, we utilized the dates of September 9th through the 15th, and we organized and held 117 separate training sessions across the greater Louisville area, and those occurred in more than 50 different locations. Some of these locations included community centers, colleges, churches, workplaces. In total, more than 2,000 Louisville residents participated in training during that focal week. Since that initiative, we've received queries from a number of communities nationwide asking how we'd accomplished our goal. And so we recognized that there'd be a benefit of us speaking through the implementation steps and background that really allow us to hold this major event. We're hoping that at the end of the session today, you'll understand the purpose, the approach that was taken, the varied steps towards implementation, and that you may even consider implementing an intervention such as this within your community. So today we're going to spend time addressing a number of different issues. In a moment, I'll explain to you about the Louisville Health Advisory Board and why zero suicide was chosen as our goal. We'll work through the implementation steps, things that we learned during the effort, the results that we achieved, and then what we believe are best practices. And at the end of that, we'll leave substantial time for questions and answers. The Louisville Health Advisory Board was organized in 2015 and was designed to be a collaborative across multiple different community organizations, all focused on improving community-based health. We've had very, very active involvement from organizations such as Metro Health, under the Mayor's Department of Health, from a number of large organizations and corporations within the community, and in addition, a large number of not-for-profit and for-profit organizations that operate across Louisville. Many of those are in the areas of behavioral health, but we have other initiatives that address other areas other than mental health related issues. You can see from the graphic the large number of individuals who are participating in the Louisville Health Advisory Board, and each of them has really played a very, very, very vital role in the accomplishments over the last 4 years. Overall, we want to make sure that we're targeting initiatives that improve the physical, mental, and social well-being for residents of Kentuckiana in the locations where they live, work, worship, learn, and play. So with that brief introduction, I'd like to now introduce Dr. Joe Bargioni, clinical psychologist. Joe?
Thank you, Dr. Slayton. I'm very happy to be here this morning to be part of this webinar and to explain to you some of the data that we used in the journey that we undertook to reduce suicides in our community of Louisville, Kentucky. So with that, I'd like to share with you some national data first as it relates to suicide. And just some of the data we know from the national data, suicide rates have increased over 30% in over half the states since 1999. More than half of the folks who died by suicide, there was no known mental health condition or disorder with those individuals. When we looked at individual subgroups or groups of individuals, we looked at veterans, and we noted that veterans had a higher risk factor of 22% of dying by suicide than other adults who were not veterans. We also looked at other smaller groups of folks in our community, such as our students or our young people, and we noted that suicide is the second leading cause of death across the country. We also looked at the LGBTQ community, and we note there that LGBT youth almost 5 times more likely to attempt suicide than to the heterosexual comparison group of young people. And then with the last data we note also is in the national study, 40% of all transgendered adults have attempted suicide, and that 92% of those attempts have occurred before the age of 25 for those individuals. So that's some of the national data we used to kind of help us in our journey in reducing suicides in Louisville. We also wanted to look at local data, and some of our local data, before I tell you about local data, let me give you the large point about the national data. You can see here visually that in 2017, approximately 47,000 people in the United States died by suicide. So sometimes we as folks, we sometimes get lost in data, but just to kind of give you a visual, if you filled up a basketball arena in your community, say if you had 22,000, 23,000 people who were cheering for your basketball team, fill that stadium or that arena up twice. That's how many people die across the country by suicide every year in the United States. Okay, so with that being said, we then took a deeper dive into our local data about Louisville, and it mirrors much of what we're seeing nationally, in that more than half of the folks who died by suicide in Louisville, Kentucky, did not have a known mental health condition. And from the years 2008 to 2014, Jefferson County, which is Louisville, we ranked 11th out of 50 comparable cities in folks dying by suicide. And it was because of this that these statistics that we made the initiatives, we have to address this. And this is what our work has been doing since 2016 by the Louisville Health Advisory Board, the Behavioral Health Work Group. So what you see on this slide is really our journey or our timeline in our efforts over the last 4 years. So you can see in 2016, we created awareness, raised the issue, and garner interest and commitment from the various leaders and stakeholders in our community and various organizations. In 2017, we engaged the organizations in implementing the Zero Suicide Initiative, which we'll talk about in just a moment. In 2018, this is why we're here today. This is where we talked about implementing and setting the world record in QPR training for our community. In 2019, we continued our work, and that was connecting respective organizations across the city for a broader system plan. And in 2020, We're sustaining that implementation of our plan, and we're also measuring impact. So you can see over the past 4 years, we have taken a systematic approach in trying to reduce suicides in our community. So as you go in your own journey in your community, you need to be having a really structured plan and a way of measuring impact. So in 2016, one of the things we did, we took the Bold Moves Against Suicide Summit, and that was in November of 2016. And we had hundreds of folks come to this summit from various organizations. We had the local health department, we had for-profit, nonprofit organizations, we had behavioral health providers, we had folks from the educational institutions, both at the public school system and also at higher ed. And that day, we had a full day of training and kind of a call to action, and we brought in Kevin Hines. Some of you folks may know who Kevin is, but if you don't, Kevin is a gentleman who attempted suicide by jumping off the Golden Gate Bridge when he was 19 years of age. Fortunately for Kevin and for us, he survived. And so it was really inspiring to hear Kevin's story and what he's doing to try and reduce suicide across the country and working with local communities. So it was a wonderful day for us to kind of a call to arms or a call to action to bring everybody in our community together to address suicide. So what we did, based on that summit that we did in 2016, we reached out to all the community partners and we asked them to create an action plan for their individual organizations. So whether you're a business or nonprofit or an educational institution or a healthcare organization, we asked everybody in the community to take steps to do that. And the steps included, a lot of the work that was done or the key pillars for the suicide initiative. Zero-based suicide initiative. So you can see on this slide, those are some of the key components of the zero-based suicide initiative that we implemented in 2017. And many of our organizations and businesses in the community continue to do that work with their employees. So in 2018, we started to think about, if we were to dream any dream we had, what would we want to do? And so what we thought about is that we wanted to reach out to our community members, to the general public, and say, how can we help support those folks in helping us address the issue of suicides in our community? And so we say, can we possibly train up to 10,000 people in our community? And we talk about people in our community, we're talking about the general public. So that could include, people at businesses, or in churches, wherever. We wanted to address those folks because we believe if we can train literally thousands of people who can recognize somebody who might be in mental health distress, who might be suicidal, and then link them to an appropriate resource, we think that's really the way to go because healthcare providers and behavioral health specialists, they're not everywhere, but we know that everybody has a loved one, a family member, a colleague, or a friend. So if we can train those folks, we can then link the person who may be suicidal to an appropriate resource in our community. So the initial big dream was 10,000. As we kind of looked into it more, we said, maybe we can set that world record. So then we started on our journey and said, what's feasible for us? And so we were looking at what can we do to address this? And we said, well, maybe it's more of a goal of, we modified our goal for approximately 5,000 folks. So the bold goal is, it's where we come together. And you can see here, it was to create the QPR training, which is a 90-minute course. And as Dr. Slayton previously mentioned, it's really based on the same premise as CPR. And so with CPR training, if you've been through that training in the past, it trains the general public individuals to recognize somebody who's in cardiac arrest, provide support to them until emergency medical services come or the person's transported to a hospital. QPR is based on the same premise. It's basically, we recognize individuals who may be suicidal and then linking them to an appropriate resource in our community to get the help that they need. The other piece about the QPR training, which I think is very valuable to the general public, it helps them to be able to have those difficult conversations. It teaches you to have that conversation with whether it's a loved one or a colleague or a friend. If you think they might be suicidal, how do you have that conversation? So I think the training is really well worth it for the folks in your community to address suicide. And then with the QPR training, there's really three key drivers to that, or three significant components to it. Is to recognize the warning signs of suicide, how to offer hope, and then how to refer to resources to help save that individual's life. Just a couple more points on QPR. It is approximately 90 minutes. We provided it throughout the day at different times of the day. So it's not an all-day activity where folks have to go to, but it's very filled with activities and information and resources. It's well worth your time. It is for the general public. So as I mentioned previously, it's really not for healthcare providers, but it's more for loved ones and friends and family members of folks who live in the community. It's provided by certified trainers in QPR. And one of the parts that they talk about is to demystify suicide and debunk myths about suicide. It also teaches individuals to how to pick up on cues and how to have that difficult conversation with those folks. One thing we make clear when we do QPR training, it is not counseling, okay? It is just recognizing somebody who's in distress and then linking them to an appropriate resource. And then the training is also really geared towards those individuals who are 18 years and older. So with that being said, you have a little bit of the data, the reason why we needed to do something in our community and our selection of QPR, and a little bit about the background of it. And so what I'm going to do now is turn it over to Kelly Gahuli. We'll talk about the actual implementation of the QPR training that we did in September of 2018 during National Suicide Prevention Week.
Then we had a fundraising event that took place in 2016 for the Bold Moves Against Suicide Summit that we mentioned earlier. And the money that we raised exceeded the expenses, so we had a surplus. So we used that, and then we used that back for our committee expenses and then for the QPR training. Okay, so then we had to secure trainers. So what we did is that we needed new certified trainers, and you want for 35 attendees to the QPR training, you're going to need at least one certified trainer. So in order to train 5,000 plus trainers in 1 week, we had to do 140 training sessions, and 45 trainers worked multiple trainings throughout our community, throughout the city of Louisville. To be a trainer, you have to be at least 18 years of age or older. So the Louisville Health Advisory Board, University of Louisville, and the Cabinet for Health and Family Services, we just started, with all the people collaborating together, we just reached out around the community and asked for people that would be interested in becoming certified trainers, and also sought out people that were already trainers. And then, so what happened in late summer 2018 at the University of Louisville, 45 individuals became certified QPR trainers, instructors. And then what we asked for them as a commitment is that if you are a newly QPR certified trainer, that you would commit to doing at least 3 trainings during that National Suicide Prevention Week. So we asked for them to make that commitment before they left. So just more about the trainers. Louisville Health Advisory Board reached out to different surrounding communities. So we reached out to trainers that lived in Ohio, Indiana, Tennessee. And then we were also able to provide a Spanish language training session. We had a gentleman that came up from Tennessee that provided that training. And then we had a new certified trainer that was also bilingual and spoke Spanish. So we were able to provide multiple Spanish-speaking language trainings. So again, we just asked them to provide as many trainings as they felt comfortable, and then again, the 3 commitment from the new certified trainers. And then we gave them goodie bags. So what we provided each of the trainers was a checklist. So this is what they would expect before the training occurred, during the training, and after. And so this was helpful. It was a tool that they could just navigate and check off, so they knew that they had everything that they needed for the training. And then our goodie bags, we got generous donations from small business owners in our community. So a local coffee shop and a local chocolate shop and things like that. And then we put a little thank you note in each goodie bag to each trainer that said, thank you for taking time and making a commitment to our community. So the materials, this is what you're going to need for the QPR training. So this is just a comprehensive list, again, just a check off so you know what to expect. So you're going to need QPR booklets, and we recommend that you order those about 8 weeks in advance, just to ensure that they arrive on time. You're going to need the sign-in sheet. You're going to need QPR certificates of completion. You want to have lots of copies of the practice case scenarios so that you can hand those out during the training. Of course, you'll need the PowerPoint presentation. And then we created a list of local resources and our national resources on a resource list, and we included that in the PowerPoint, but you want to make sure that you have that. So you want to plan ahead and have the suicide prevention hotline numbers, local mental health agencies, acute crisis stabilization, hospitals in your area. So you want to make a really nice comprehensive resource list. And then logistically, you just want to make sure that when you're picking your locations, that you have AV equipment, computer, flash drive, projector, all those kind of Wi-Fi connections that you want to consider if that's needed, and then an embed video in the presentation. So these are just some examples of just some of our materials. Like I mentioned, the sign-in sheets, the QPR booklets, the certificate of completion. At the bottom is just an example of some signage so that you can guide people in if it's difficulty finding the entrance to the building. So then we had to think about locations. So we just started, putting the word out and saying who would be interested in hosting a QPR training. And so we looked at local community, neighborhood places, churches. Some of the current members of our Louisville Health Advisory Board Committee said they raised their hand, I'll have one at my agency. And we wanted to make sure that they were scattered throughout our community so that we were giving people all throughout our community access and the ability to attend a training. So it was local and for them to easily attend. So then once we secured locations, we just asked for the commitment to make sure that they were definitely on board. And then we also recommend that you send either a member of your committee or someone that's working on this project to actually go out and look at the location in advance. Because you want to consider, is it easy to locate? Is it easy to park? Is it going to have everything I need, like I mentioned, with the projector and access to Wi-Fi and things like that? So you just want to make sure that you go in advance. And then once the different locations said, yes, we're on board, we definitely want to host a training, then we sent them a message saying, thank you so much, we appreciate you hosting the training. And so this is just kind of heads up in advance as what to expect. So if you can send us the specific dates and times that you want to have training, some of our agencies and community locations said, during Suicide Prevention Week, I want to host 3 or 4. We said, that's great, just make sure you let us know what day, what time, and everything to expect. We let them know that, as we mentioned earlier, the training typically takes about an hour and a half. And then we encouraged them to, if they had the ability to set up classroom style, so then they knew how to set the room up. And then again, maximum 35 people for one trainer. If you're expecting more, let us know in advance so that we can help accommodate and seek out additional trainers if there's going to be more than 35 people that would attend the training. And then making sure that can we send you the PowerPoint in advance, or how do we need to make sure that you have that PowerPoint so you're prepared? And then also letting us know can you send us directions? Can you let us know where should we tell people to park and things like that, so we can give a heads up to anyone planning to attend. So then the week of operation. So that is going to be all hands on deck. And so National Suicide Prevention Week, like we said, is when we initiated the QPR trainings. And so we set up a sign-up genius, which you just want to be careful with that, because there are going to be some employers or agencies or people that say, well, I can't access Sign Up Genius because of my IT firewalls. So just have a backup plan. You might want to have a specific contact number that someone can call to register, or a place to RSVP if they cannot access Sign Up Genius. We also made sure that we had backup trainers, because we know that sometimes there's just unexpected emergencies or illnesses. So you want to kind of have a list of some potential backup trainers. And we also have people on our committee that said, you know, I'll be on call, I'll be a backup just in case as well. And then we also want to make a plan for how are you going to get all the materials to the trainers. So we picked just different locations that we would meet our trainers. We kind of decided that in advance. Hey, I'll meet you at a restaurant, or I'll meet you at someone's office, and I'll hand off all the QPR booklets and certificates. So you want to think about all that logistical things in advance so you know how you're going to hand off the materials. We requested that the trainers scan or photograph the sign-in sheet. And also we had our attendees sign a consent saying it was okay that we took their photograph so that we could send that on to our marketing committee so we could track the attendance. And then, as mentioned earlier, we were trying to get into the Guinness Book of World Records, so we wanted to make sure that we kept a very comprehensive list of all of our trainings across the community and everyone that attended so that we can make sure that that was also captured in our within Google Docs. So these are just a few pictures of our lovely participants and attendees. And again, we offered them throughout the entire city of Louisville and various different parts of town so that everyone had the opportunity to attend. They look very happy. So again, we suggest that you can set it up however is most comfortable for your attendees depending on the type of room, but you can see there's different types of rooms and different setups. But again, if you can, classroom style. So marketing. So how did we get the word out? How did we let people know about it? Because we had a lot of trainings in just 1 week. So we had to make sure that we captured as many different audiences and avenues as we could. So we had a very comprehensive integrated marketing plan. We targeted television, radio, print, and a digital campaign. The question Persuade and Refer training received 106 placements and nearly 3 million impressions, including the 14 event listings and 6 Louisville Health Advisory Board press releases. And I'm going to talk a little bit more about some different ideas of ways you can get the word out. We had a press event with our mayor. He was very supportive and signed a letter of support. And so we had a press conference, and the bottom is a picture of our committee and members of our community that came and wrapped their arms around this initiative. And so we really appreciated our mayor's support of our QPR initiative. On our website, on the Louisville Health Advisory Board website, and then part of that is the qprlu.com, we also put all of the QPR information about the trainings. If you're interested in being a trainer, if you're interested in being a host for the trainings, that was all listed there. We did a press release that was featured on the Louisville Metro Health and Wellness website. We also created an Eventbrite page. And so our digital advertising proved to be an efficient means of really driving that attention and action. So you can see some of the numbers here. So we had 1,357 registrations, so 44% there. On 35%, so 4,300 landing page views. We had lots of social media impressions and likes, so that drove a lot of traffic. And again, we spent about $5,000 in digital media. We also did some marketing on our local Louisville Metro Health and Wellness website. And then we did a blast email out to our entire distribution list from our Healthy Hometown email distribution. And we also exhibited at some community events, so just had a table. We had a tablecloth, put up some balloons, handed out flyers, handed out information about the different trainings around the community to generate enthusiasm and interest in making sure people knew about that. They were visiting different community events. And lastly, we engaged our local television stations, and they did some really nice press for us. So just locally, some of our news channels, WLKY, WHAS, and various television press. So that's how we got the word out, and that's how we created the buzz and got the attention for it. Okay, so next up, I'm going to introduce Tracy Meyer, and she's going to talk to you a little bit about the results. And I'll let Tracy come on up. Oh, Val, you're coming.
He's still here.
Okay.
Thank you, Kelly. So you've heard a lot about what we did in a very small amount of time. 1 week seems like a lot, but it really was a week of excitement, of coordinating, of having each other's backs, many things that could go right and wrong all in the same week. I wanted to talk a little bit about some of the variety of individuals and communities that we worked with. So we wanted to reach out to our entire community, and I really appreciate that we were able to provide Spanish-speaking QPR sessions. So those were done, I think we did 3 in one day, or 2 in one day and 1 the next day. The community here was so appreciative of that, and it was also very specific. So we did a lot of work to make that happen, and we brought in an individual who was actually a chaplain from Tennessee, who was very generous with his times. A little bit, so we already talked about that between the September 9th and the 15th, that there were 117 trainings, and we were at 50 different locations, and we trained 2,200 individuals. And I think that that's significant. One question that I had already received is, did we meet that Guinness Book World Record? And as we went through this process, you know, we really had to think about what do we want to accomplish. And I think what we did was pretty phenomenal. So anyone that had signed up and they were going to be part of this, they came in, we gave them information about a SurveyMonkey link because we wanted feedback from them. And when you do QPR, you actually do have a survey that you provide the individuals, so we get good feedback about what somebody took from that, or you know, what they would like more of, those kinds of things. So in the questionnaire that was linked to them, we wanted to know, what did they think of the program? The presentation itself, you know, the content, and what was the value to you? QPR has a standard evaluation questionnaire, which was incorporated in that as well. It's very important that we follow those guidelines of QPR. So out of the 2,200 individuals, we actually got 84% of the response answered each question as above average or outstanding. And as you can see, we got about 700 responses. One of the things was just managing the paper and wanting to get data pretty quickly. So we thought that the SurveyMonkey link would be helpful. People had the internet accessibility, so they could, if they had time, do it in the class at the end of the class. But the results were very, very positive. We were very happy to see that. And we're very, very grateful and thankful for all of our trainers, for all of the people that opened up their businesses or their community center or the mayor's office or wherever we ended up. Very, very grateful for everyone that participated. So a little bit about best practices. So I am one of the QPR certified trainers. And it's very, very specific. There is a set of slides that you must use. We advise that when possible, you match trainers with the population. And the reason why we're saying that is what we learned in the community was that there might be particular audiences that had very specific questions. And for an example, I worked at the University of Louisville, so I had always trained students and faculty, and questions were pretty similar. And then when I got into the community, questions were very different. And we had actually had a suicide that had gotten a lot of media attention of a child. And so that particular audience were a lot of parents, and they had very, very specific questions. And so one thing we recommend, if you do have something close to a very public suicide, you have some experts in the room. So if you're at a school, maybe you want to bring in the school counselor to be a support for any questions that might come up at the end of the training session. It's very important to provide a way for people to share their stories afterwards. This was sort of a lesson learned. We got a lot of people that reached out to us and shared how they may have already used QPR in the first week or the first month after attending the trainings. But I think we would like to recommend, if you do something like this, that you have a place that people can share their stories. So whether it's an email or whether it's some sort of way that they can get back to you and communicate to you as well. As far as locations, mapping is very important, helping people know how to get there. Knowing where you're at is when you're planning and you're implementing it. Like, are you reaching every place you want to reach in your community? So there's things that you can use to make sure that you're reaching those communities, and there's links that you can share to people so that they know how to get to that particular place. If they're not familiar with where they're going, it's a little stressful if you've got to find parking and those kinds of things. So very important to have those details available for the people attending the trainings and for your trainers, because you don't want a trainer to get lost and be a little razzled before they come in. One of the things we learned too, as we tried to put this together and we recommend, is have your trainers identify their own, like what they can do in their own locations. And that's where we used Sign Up Genius, and we did have some bumps with firewalls. But it was a way for a trainer to go in, and I was able to provide 10 sessions during the week, but maybe we had, like our gentleman that came in from Tennessee, he had a day and a half. So he had to really give those trainings in that day and a half, where I had more availability throughout that week. And so I could go into that particular setup and say, I'm available, three sessions on Wednesday and maybe one over here on Friday. And I can't say enough about having a backup person, which we utilized several times. So we actually had a backup trainer assigned to every day, or like part of the day in the afternoon, so they were able to be reached. And that information is shared with the trainer and also shared with the person who is hosting the training itself. When we were trying to sort of push people to do trainings that maybe they weren't available for, it just wasn't a good fit. And so the Sign Up Genius, I think, worked really, really well. Also, getting the host to engage the population in advertising and welcoming and being present there, get them to be signed up so that your trainer can kind of be ready. But if that doesn't happen, then it's definitely the responsibility of the trainer to make sure you have your sign up. It's very important for a QPR trainer to be tracking how many people they're training while they're certified. I can't say enough about our project planner who volunteered her time, and quite a lot of time. We had a great committee that was very, very dedicated to making this happen, but she definitely was the glue that held that together. So having somebody, at least a point person or maybe a small group point persons that are taking part, like we had somebody specifically for marketing, we had somebody specifically for training, and then we had an overall project manager to keep all those details together. So those beautiful Excel sheets, she managed to get to all of us. We started planning in June for this September, and we did it. It was a lot of work. I would recommend give yourself more time than you think you need, because there are just a lot of wheels that have to kind of get in motion, but it was worth every second of our efforts. So some other resources we had available during that week, and they're still able to go and get information, are listed here. These are all different active links. So we do have an email account, and so individuals could email and ask a question or follow up. We did have QPR Institute, because if somebody was curious about really what is QPR, they could go there and learn about it. We had our Facebook page, we kept that going as well, and a lot of us had Twitter and Instagram and those kinds of things that we were also trying to share that as well as our main page. So having places where people in social media can gather information, or a person who, well, I'm thinking about going, it's 11 o'clock at night, where can I get information? So lots of good stuff was on each of these resources. This is the example of our national resource page. Many of you might have heard that we may be getting, it looks like a 3-number suicide prevention lifeline. I'm sure there'll be some advertisement for that. So if you're doing national resources, please make sure you have the right information, the right numbers, because you just never know when somebody's going to be reaching out. We had a lot of people take photographs of this particular page. We also had that listed on our QPR Lou page as well, so people could go back to that. And we told them that during the training. Please feel free to go back to that. As you can see, we have the basic lifeline. I always include the Veterans Crisis Line. It's very specific for veterans, very good information, helps right away. The thing about the National Suicide Prevention Lifeline is there's lots of languages. So if you don't have secondary languages available in your community, that can be very helpful as well. Very specific ones also to the Trevor Project for LGBT youth, and then our Trans Lifeline as well. In the I'm Alive chat, what we're learning, especially in younger generation, is that actually texting, the crisis text line and the chat lines are being utilized quite a bit. So that's an easy form of communication. It's also a very private form of communication. If I'm in a place and I don't want to be heard what I'm saying, but I have questions or I'm struggling, it's a great opportunity and option for them. So that is the end of our presentation. Again, I can't say enough to all of the trainers, the site hosts that put up with us and did emergency last minute things, and the participants for coming in and asking really great questions and sharing great stories, and then getting back to us and telling us how they utilized what they learned to save lives. That was very rewarding. I'm getting goosebumps talking about that because that was what we really wanted to do, was save lives. So purpose of this webinar, once again, was just to share our details of our initiative. So we would like for you to have that opportunity to learn what we learned and use these tools, reach out to us, and do this in your community. We challenge you to 2,201. We'd like for you to break our record. And here's a list. We saw their nice logos earlier, but also a list of all of the individuals on the Behavioral Health Committee. Can't say enough, again, for all the people that volunteer with us. You want to take a seat?
Great. And I'd like to invite our panelists to come up for a question and answer period. And we would ask that if there are individuals who do have questions, if you could type them into the chat, and then we'll be able to direct them appropriately. So with a year, to put things in perspective, if you were to repeat the effort, any major changes you would make given the learnings from the 2020-18 effort?
I think from my perspective, it's that planning process, because it's a large undertaking for your community. As Tracy was sharing as part of her presentation, we had about a 3-month period from June until the middle of September to do this. I think if you're going to undertake this as a community-wide effort, that you want to give yourself a little bit more time in the planning process, because you can never plan enough for a large event like this.
I would agree, Joe. I remember the day we were in the conference room and we were making goodie bags and we were counting certificates and we were, divvying out, and I think planning way more ahead of time. We also put chocolate in our goodie bags, and that was probably not a good idea because we were having our trainings in September, so don't put chocolate if it's going to be a summer month. But yeah, so starting earlier, and also probably delegating and assigning specific tasks to, if you have a committee, and making sure they understand their role and that they're committed to that role, because it seemed like for us, just from a lesson learned, that there were certain people that were doing a little bit more work, and our crew got smaller and smaller and smaller. So those are my thoughts.
I think one of the advantages that I had is because I was working as the coordinator of the GLS grant at U of L, it was part of my job. And so for the person who really oversaw the project, it was an add-on to her job. She was very committed to it, but it was overwhelming. And so I think if you have the ability to partner with the state, if they have a GLS grant, that can really help with resources. Our state grant is 50 miles away, so sometimes getting them to be here in Louisville could be a bit of a challenge as well, so distance, being respectful of that distance. I think I'm just going to reiterate, it felt like if we had more time, I think that what we did really well, though, I mean, the marketing, they really took care of that. They really did what they needed to do. And so that was a really strong committee. I think our training committee was also very strong, but I was able to devote a lot of time to that, and we were able to utilize the state as well. But I think when you have people join a committee and it sounds like a great idea and then it seemed like a lot of work, there was some dwindling. So maybe have more people at the get-go and have very specific tasks as well. And I think that's very similar to other people's thoughts.
For those folks who are not as familiar with QPR, can you tell us, were all of these training in-person sessions, or were some of them done through broadcast or WebEx or other distance learning? You speak about that?
All of the QPR sessions that we provided were in person. One of the things about doing something online is QPR Institute can do that, but as a trainer you cannot. And another really important thing for you to understand too is you cannot actually video it and then put it on your personal website. And that's part of the copywriting that goes with the QPR training. I think the other thing about the in-person is there are a lot of questions that come up, and there's a practice that happens as well. And so that practice of asking another person, you know, are you going to kill yourself? Like, that is something you have to have come out of your mouth. And so I think the in-person allows that sort of real human touch and real human practice that's very, very important. I think it was a real community builder too. Each community that we went into had its own personality, had its own group of people, and I think they really appreciated having this sort of gift, you know, to show up. It didn't cost them anything. And most of our trainers, I would say, were more than willing to probably stay after and chit-chat and talk and learn. So I think the value, at least in our community, I think we're a people kind of community. We like face-to-face kinds of conversations.
Mm-hmm. If I can add to that also, I would just say know your community. And when you're in the planning process, in Louisville, we're an urban area. We have multiple languages spoken in our community. We have differences, some equity issues. And so when you're thinking about placing where your trainings are going to be mindful of a couple of things. Some folks may not have their own transportation, so you want to make sure that if you're having, I guess the overarching one is bring the training sessions as close to your populations in your communities as much as possible, because there are going to be people in your community that don't have their own car, so then they're going to rely on public transportation. So you want to be mindful of those folks. And then also, if you have a diverse community, having it presented in different languages will be helpful. And know where there's probably going to be pockets in your community where you may have higher rates of suicide, but it's difficult to get into that community. So that's where you rely on your ability to communicate with some of the leaders in that community. You may go to the faith folks in that community, the churches or the synagogues or the mosques, and talk to their leaders and say, hey, can you help us bring a training into your community? So my one takeaway from this experience is bring the trainings as close as possible to your different communities in your city or in the area where you live. Provide it in different languages if possible, and then just be mindful of transportation issues.
And I would totally agree with that, Joe. And I think just to add on to a little bit what Tracy said, the in-person, doing the training in person is so valuable because that hour and a half, because that last 30 minutes is vital because when you're practicing it, because I think that's where people get stuck. So if they encounter someone and they say, you ask the question and they say, yes, I want to commit suicide. And then they're like, now what do I do? But practicing it, doing that role playing, having those case scenarios is so important. And I think that's a huge teaching moment for people.
Good morning. This is London, and I've been chatting with you all in the WebEx chat feature. Thanks everyone for joining. There's been some great discussion and sharing, and have already heard one person who said we want to implement this in our community. So hopefully there's more of you. We have individuals from Lake Charles, Louisiana, Lubbock, Texas, Hastings, Nebraska, from Louisville, here in Louisville, and Alabama. And Nicole in Alabama says she's in a rural community, as we were just talking about how to engage different communities. And they offer free question, persuade, refer training, but they often find it's hard to get engagement or participation from the community. And didn't know if any of you have any ideas around that? Any thoughts?
I think one of the things that we did in our community, and again, where Louisville's definitely not rural, is we reached out to local officials. So we reached out to the Louisville Metro Council because we felt like they knew their community better than we did. And we kind of got a feel from them. They're out talking to their constituents. So just like the mayor came on board and did a beautiful press conference and actually hosted a very large training in the morning, are there individuals who are in her rural community that could be the leaders in gathering that? I can't say enough about reaching out to pastors and religious leaders. There's a lot of training that goes on. There's actually some QPR specific training for elder care, but there's also some trainings for the Suicide Resource Prevention Center that does for our rabbis and our priests and our pastors. So getting them engaged. It's interesting too, I've heard some things like beauty shops and barber shops, and where do people gather? You know, where is it that they might gather that leader might be able to help get people involved? And I feel strongly that, you know, if it's 3 people or 35 people, those 3 people are going to tell 4 other people, and you know they're going to have that reach. I know it can be discouraging, but I think that there are ways within that community to reach out.
If I can just add to that also, is think in terms of what organizations, especially if you're in a rural area, what organizations interface with families. And so obviously one organization are healthcare providers. So your physicians, your physical health folks, behavioral health folks, the conversation with those folks. Many of the counties will have a health department, so that might be a group. So you want to focus on the healthcare providers, and you also education, right? Whether if you have a local higher ed, a local college, or the public school system, they're another group of folks. We mentioned the faith community is an important piece too, and then social services. And then I think a key point is a lot of times in some communities, some of the businesses, if you're in a rural part of your state, there may be one large employer in your state, in your community. So you maybe want to reach out to their CEO because that person's employees are, you know, the people we need to reach. So, you know, don't be afraid to reach out to the local businesses. Then the other thing is think creatively. One of the things we do here in Louisville, we've had some success in a non-traditional way, is for the last couple of years we have a local music festival. And so we actually provide the QPR training at the music festival. And so that, I think, is another way of trying to penetrate the market or getting to a group of folks, because that event is more geared towards young people, and sometimes they're difficult to reach out to. So think creatively. So in Louisville, we have success in going to a music festival.
I might also say taking an opportunistic approach. Unfortunately, it seems as though several times each year that there's national news coverage of a prominent individual or celebrity who dies by completed suicide, and that following that period, there's a real heightened interest and concern. And so if you've got a trainer within the community, if there is an event such as that, you may find that there's tremendous interest in organizing training within a week or two after that. And so if you've had prior conversations with any of the organizations that our panelists have sort of mentioned, it may be then straightforward to organize a training that could include 20 or 30, 35 community members. So I would probably mention that as well. So. Last question, in terms of the timing of the sessions, were these held predominantly during daytimes, evenings? Can someone comment on that?
As early as 8 o'clock a.m. and as late as 8 p.m. So we tried to capture people before maybe their workday, during the workday. A lot of the employer groups happen then. We were actually at a conference too. And then in the community, we have some later ones in the evening.
Fantastic. So we want to thank everyone for joining us today. We hope we've been able to convey to you our enthusiasm around the efforts, and that although it may appear to be a very complex task, once broken down into manageable parts, it's a very doable effort within the community. It's a great way to be able to really work to help educate and empower individuals. And so we hope that we'll hear about other communities that are interested in pursuing this sort of approach. There is a website on which we've housed our information. That's qprlu.gov.com, qprlu.com. And we've tried to make that a website where people can return to obtain additional information. There's also a link there for sending messages in case any questions or thoughts occur. So with that having been said, again, want to thank everyone for participating with us, and we hope you all a wonderful holiday season, and we hope we'll be hearing about community-based QPR training across the United States. Thank you.